Communicable disease technique. Hand washing. Turn on the faucet. Wet hands and arms. Avoid splashing the water and hold hands lower than the elbows. Dispense liquid or powdered soap onto hands and lather. If bar soap is used, rinse bar soap before and after using. Rub palm, wrist, and back of the hands firmly with circular movements. Interlace fingers and thumbs, moving hands back and forth. Lather hands and arm well. Clean your fingernails as needed with a nail file. Wash each hands and arms for 30 seconds. Holding your hands and forearm lower than your elbow. Rinse thoroughly, starting at one elbow and moving down the arm. Then repeat the steps for the other arm. Dry hands thoroughly from fingers to forearm and arms. Most facilities provide paper towel for this purpose. Blotting with paper towel is easier on the skin than rubbing. Discard paper towel in proper receptacle. Use a dry paper towel to turn off the faucet if it is hands operated. Take gown from isolation cart. Grasp gown by collar, allowing it to unfold. Place arm through sleeves and pull gown over the shoulders. Fasten neckties, overlap the gown at the back and fasten waist ties. Position mask over mouth and nose. Bend the mask nose bar over the bridge of your nose. If necessary, wear goggles and hairnet. Take clean gloves and do open gloving. Transporting the patient outside the room. Explain the procedure to the patient. If patient is being transported from a respiratory isolation room, tell him to wear a mask for the entire time the patient is out of the isolation room. Help the patient into transport vehicle. Cover the patient from shoulder down with a sheet. If patient is being transported from a wound, skin, gastrointestinal, strict isolation, or protective isolation, Cover transport vehicle like a wheelchair with a clear sheet before you enter the room. Tell the receiving department what type of isolation the patient will need and what precautions the hospital personnel should follow with the patient. When the patient returns to the original isolation room, help him or her into the bed. Cover the transportation vehicle with clean sheet and remove it from the room. Instruct all hospital's personnel to wash their hands before leaving the area. Clean the transportation vehicle with an antimicrobial agent. Removing items from an isolation room. Close the half to 3/4 full of contaminated bag inside the isolation room. All items contained in isolation bag to be returned to CSR are listed on the tag, which is placed on the outside of the bag. Guidelines in disposing equipment from isolation room. First, disposable glass items are placed in isolation bag separate from burnable trash, placed in appropriate hospital area for disposal. 2. Metal equipment to be returned to central supply room is bagged together. 3. Police equipment to be returned to central supply room is bagged separately from metal equipment. 4. Rubber and plastic items for gas sterilization are bagged separately and returned to central supply room. Soiled linen is placed in the laundry bag and brought to laundry room for special care. Plastic or paper dishes are disposed in burnable trash. Last, food and liquid are disposed down the toilet bowl and flushed twice. Set up a new bag for continued use inside the room. Have someone outside the room to hold a clean bag cuffed over his or her hand. If no one to help, assemble a clean bag in a hamper stand before you go into the isolation room. Position the hamper stand outside the room for easy access. Place the contaminated bag into the clean bag being held by other person or in the hamper outside the room. Be careful not to contaminate the outside of the clean bag. Close the clean bag and mark it isolation. Removing contaminated gloves, gown, and mask. Remove gloves by pulling them over your wrist and finger until each glove is turned inside out. Untie waist ties and let hang freely. Untie neckties and let gown fall forward off your shoulders. Slide arms out of the gown working from the inside. Holding your gown away from the body, fold contaminated side of gown toward the inside. Discard gown if it is disposable. If gown is usable, hang it in the appropriate place. Remove and discard the hairnet and mask.